Hi everyone, I'm Dr. Sohan. Today I'm with Dr. Srinivas CH. We are from the Department of Musculoskeletal Oncology at Prakriya hospitals to discuss about a case after treating which we are very happy and we would like to share the details of the case with you. So today we are going to discuss about this 43-year-old gentleman who comes from a town near Guntur. So he's had a tumor of his knee. He's gone to multiple premier institutes of India where he's been offered only amputation. He's very hopeful of a limb salvage. He wants to retain his limb. Sir, how did this patient come to our hospital?
So basically, I received a call from the patient saying that I have a big tumor in my knee and most places have told amputation, but I want to somehow salvage the limb. Can I come and meet you? Then I said, okay, initially you send me the reports on WhatsApp. So the patient was somewhere in Guntur. So he sent me the reports. I saw it. I realized that the case was more complex for me to respond on the WhatsApp. I asked him to come down. So he came down. Then we studied this case in detail, and then that's how this patient turned up.
So Mr. Rajarapu is a 43-year-old gentleman working in the health department of Andhra Pradesh from a small town near Guntur. In fact, he's suffering from this disease from about 17 years. 17 years ago, he was diagnosed with a condition of his knee. After that, he has underwent a procedure at about 14 years ago. Thereafter, even though the disease was progressing slowly, around 1 year back, somebody has done a total knee replacement in presence of this disease. Thereafter, the condition worsened drastically. He's come to us with a drastic, massive tumor in his knee, severe pain, on a wheelchair with inability to walk. And his personal background is that he is suffering from a congenital disease. From birth, his one eye is blind and he has an opacity in the other eye. And there is a history of congenital liver issues in his family. Two of his brother's children have died because of this, and presently his son is suffering from a liver disease of congenital origin. With this huge load, he's come to us. So how did we evaluate?
So basically, we saw his X-rays, MRIs. Unfortunately, he had a tumor long back. The diagnosis was desmoplastic fibrosarcoma, and somehow I was not convinced about the rapid growth. Generally, these tumors are slow growing. That is one. PET scan showed no other metastasis, but the problem is the tumor is huge. It's involving the patella, the quadriceps mechanisms, which is very important for extension of the knee. And not only the femur thigh bone is involved, the tibia, that is the proximal part of the tibia, that is the leg bone, also is involved. Now the knee joint is also involved. Now with this background, one good thing is the blood vessels seems to be fine, though it is not very clear, but I felt that blood vessels will be generally okay. One other problem is he had a foot drop. So these are multiple problems. So it is natural for anybody to say amputation, abony amputation, because it's very difficult to salvage. If you excise the whole thing, we'll be putting so much of hardware. His quadriceps function won't be there. He may need a plastic surgery coverage. On top of his financial problems, if he undergoes infection or something like that, he will be drastically affected by this. But then we thought one more thing we can do. Can we remove the tumor fully? That is the first question we asked. Yes, we can remove the tumor. We have to remove the femur, we have to remove the knee joint, patella, the tibia, everything has to be removed. If there's a bone defect, skin defect, we can always put a flap, a skin plastic surgery flap can be put. Second is, how do we manage this function? How do we reconstruct? So I thought maybe we can't do a mega processes to keep his joint active because of these problems.
That would be the first choice.
Maybe can we do arthrodesis, where can we fuse the knee joint? So for that we have done a few cases before. So we planned for putting a nail, a long nail from his trochanter, the hip region, crossing the knee, going up to the ankle, almost up to the ankle. And then there will be a defect where we can put a cement. So with this construct, knee will be straight, he can't bend, but he can put full weight on walk. And if there's a skin defect, we can always take a skin and muscle from the abdomen or elsewhere and cover it over. So this was a plan, I offered it to him. So he was more than willing to accept it, because if you do a abony amputation, it will be a very high abony amputation. The stump will be very small. If he has to wear such a big prosthesis and walk, it's going to be very difficult. So this is a better thing. He'll have his own foot where he can have he can walk and feel the sensation. So this is what we are planned right now.
Sir, this patient has gone to multiple premier institutes of India. They have convened tumor boards. Our tumor boards have decided to go with an amputation. Now you have decided that you want to do a limb salvage, and you are taking head on against their decision.
Right.
How sure are you about your plan?
See, in oncology, there are utmost is to get a tumor-free margins, right? In this case, can we get a tumor-free margin? We ask that question. Yes. If you remove the femur, the patella, the cortical mechanism, the tibia, the joint, we can remove the full tumor. I was very sure about removing the tumor, number one. Number two, function. As long as we can make the patient stand and walk and restore the function, if these two things can be achieved, we can do a limb salvage surgery. And I felt that these two can be achieved in this fellow. The third most important thing is patient was very motivated. He was very keen to try it out. He was willing to try this out. And that is the most important thing. If patient is ready, then we can always try. If you undergo an amputation, the function is not so great. So I felt that instead of going straight away for amputation, we can always give a trial of this. If it does well, he will do well for the rest of his life.
Yes.
Of course, there could be chance of recurrence. There could be chance of infections. These are part and parcel of all our surgeries. 10% patients do have complications, then we can see. But 80-90%, if it does not end up with complications, he will have a own limb and nothing like that.
Nothing like
Isn't it?
Sir, I clearly remember that this surgery lasted for about 12 hours. Can you tell them what happened during the surgery?
So obviously we expected it to be a bit more complex. Excision of the tumor was challenging, but we could achieve R0, that is clear margins. There is no tumor anywhere left behind. Then we put a nail, that also went through very well. We put a bones, the cement to reconstruct that. Unfortunately, the skin was available for us to close. But if you close the skin just above the cement, it might break down. So we asked the plastic surgeon to remove the muscle from the abdomen, which is called rectus abdominis muscle. We took that muscle and then that was fixed and anastomosed. So microvascular surgery took some time. So total surgical time was almost 12 hours. But post that, he did well. We waited for 2 weeks. There was no infection. We started making him walk. And he's walking now comfortably. Hopefully, going forward, I feel he will do well. His first problem of saving the limb is managed. The second thing is complications which we thought might happen. That was also taken care. In the long run, we'll have to, every 3 months, we'll call him. We'll do a evaluation to see if there's any recurrence of tumor. And if for 3 to 5 years, if he does not have any recurrence, I'm sure he will do very well.
Sir, it is still perceived that cancer surgeries are not very fruitful. Many patients, people still think that many patients die after getting cancer. You were an orthopedic surgeon. Other surgeries in orthopedics, general orthopedics, are very simple. Patient comes, you fix their fracture, they go back quickly. You do a knee replacement, they go back walking. The satisfaction rates are much higher. Here, most patients have a lot of emotional problems. You have to deal with their primary disease. It's not as clean as general orthopedics. What still motivates you to continue doing these challenges?
See, this cancer patients, one myth about cancer is every cancer patient will die. The number one myth, which is not true. In orthopedic oncology, at least to my 15 years or 20 years of practice, what I realized is if the patient comes reasonably early, if you do the right chemotherapy, right adjuvant therapy, right surgery, 60 to 65% of them will survive for the rest of their lives. And unfortunately, bone tumors are very common in childhood, adolescent, and of course it can be in adults also. Now imagine the quality of life they will live. Now chemotherapy they do, they may survive. But then people are, most common surgery today, even today, is amputation. Imagine living their life without a leg. Okay, imagine another scenario. You have cancer, you might die in 6 months to 1 year's time, and then you have a tumor or a very painful leg, and somebody says, I'll do an amputation. Imagine the quality of life they're going to live for the next few months. So for both can be solved. So today, limb salvage surgeries have become very advanced. We have a lot of implants, good implants, and a lot of other procedures have come which is very cost effective also. Most of them can afford. Like a simple nail cement spacer will not cost much. The satisfaction of having a limb is great. And that is what we are trying to do. One, we are trying to remove the tumor fully for patients who we are trying to cure. Number two, we are trying to give a function where they can live a reasonably quality of life. And today, almost like from past 20 years, we've been doing this work. And there are a good number of patients who are living a good life. Children who come to us, they finish their treatment, go back, study. They've studied, they've done very well. Some of them have done medicine, they've become doctors. Some of them are running their own shops. Some of them have become teachers. It's very satisfaction to when you see these patients. It's worth working on these people. Complications are part and parcel of the surgeries, but I tell you, the complication rates have come down drastically because the surgical skills have improved, implants, the technology has improved. So we're not seeing that many complications which we used to see long back. So I think it's a very acceptable level of complications, and the function is extremely good. So that is what we're trying to achieve, and that when the cancer patients are with you for the rest of your life. When they come,
Correct.
when they grow up, when they're doing all these things, and then when they come for follow-up, it's very satisfying to see. So it's good for them, good for us, and as long as they are motivated and we are motivating them, then that is good enough for us.